A study focusing on HIV prevention is getting underway in San Diego. Researchers at UC San Diego are involved in a 4-year study to test an HIV prevention pill on high-risk individuals. Joining me is Dr. Richard Haubrich, professor of medicine, who's leading the study at UC San Diego. Dr. Haubrich, it is such a pleasure to meet you. Now, you've been studying HIV research since the early 90s. How excited are you about the advances made?
The advances in HIV care have been incredible. I've gone from the days when I was taking care of patients when I had very little to offer them and their life expectancy was really quite poor. And I've really had the privilege of participating in studies throughout the years as we improved our therapies, got more tolerable therapies, so that now we can get most people's virus under control. And that means that their life can be significantly extended, almost to as it would be without HIV.
So tell us about the focus of this study you're involved with and how you're collaborating with other teams.
Sure. So one of the key things that's an advantage of being in clinical research like I do is getting to work with so many other talented people. So we're collaborating with behavioralists, pharmacologists, statisticians to put together a team to do this study to look at prevention medicine called Truvada. This medicine has been studied before and shown to be effective, but what's key is finding ways to help people be really adherent with the medicine. If they don't take the medicine, it doesn't help them. That's been shown from the clinical trials that have been done so far. So we designed our study to test a new intervention using text messages and something we call an alert worker to help people be adherent to therapy.
So kind of like a reminder to take your pill?
Exactly.
All right.
Exactly.
So it seems like this comes with a rather steep price tag, about $10,000 a year for daily use. How can this research aid in bringing the cost down?
I don't know that our research can bring the cost down. We'll show that it can be done in a more clinical setting, not in a randomized clinical trial versus placebo like was done before. And so we'll look at the costs. We'll certainly see how expensive it is to do all the laboratory testing. I think the key to reducing the costs is the more medicine is used, eventually the cost will come down, as it has significantly already.
Is it a challenge getting healthy people to take a pill to prevent something?
It's a challenge, definitely. It's been a challenge through the years to get people with HIV to take their medicine. And so we're continually working on newer ways and working with our behavioral colleagues to design interventions to help them do that. And that's key of what we're trying to do in this study as well.
Then tell us how you're recruiting people and how you will determine if they are at high risk.
So we're recruiting by working carefully with our colleagues that are doing testing at the public health departments at our site here in San Diego as well as in our other 2 sites. They'll refer people who are tested for HIV, which obviously that means they're at risk since they're having a test, and they'll be referred to us, and then we'll do a fairly detailed questionnaire about their risk behaviors. And if they qualify by having continued high-risk behaviors, they'll be offered entry into the study.
And what kind of follow-up support will you offer?
So the key to giving any biomedical prevention like Truvada is pairing it with a whole prevention package. So that's going to include methods to reduce their risk behavior using condoms and repeated testing for sexually transmitted infections that can increase HIV, as well as repeated HIV tests.
And I guess the final question is, how will you determine if the study is successful after 4 years?
So what we want to do is to show that we can maintain people taking the medicine at high levels. And secondly, if this texting intervention improves that. So if we can get people 80–90% adherent, we think that's going to allow it to be successful.
Well, this sounds like a fascinating study. We wish you well.
Thank you.
Dr. Haubrich, thank you.
Pleasure.